Vilazodone is an antidepressant agent used for the treatment of major depressive disorder that targets the 5-HT transporter and 5-HT1A receptors. In this video, let's found. What is Vilazodone? What is Vilazodone used for? Contraindication. What are the side effects of taking Vilazodone? How does Vilazodone work? How to use Vilazodone? What is Vilazodone? Vilazodone, sold under the brand name Viibryd among others, is a medication used to treat major depressive disorder. It is classified as a serotonin modulator and is taken by mouth. Vilazodone was approved for medical use in the United States in 2011 and in Canada in 2018. In 2019, it was the 334th most commonly prescribed medication in the United States, with more than 900,000 prescriptions. The drug lost patent protection in June 2022 for adults, and is scheduled to lose exclusivity for pediatrics in July 2020. Generic versions have been approved by the U.S. Food and Drug Administration, FDA. What is Vilazodone used for? Vilazodone is approved for treatment of major depressive disorder. Contraindication. People who are taking monoamine oxidase inhibitors, MAOIs, or in the 14 days before taking Vilazodone. Pregnant women, lactating women or children. People with severe renal impairment. Side effects. Digestive system problems, such as diarrhea, nausea, vomiting, and abdominal pain. Sexual problems, such as erectile dysfunction and decrease in sex drive. Insomnia, not being able to sleep. Sleepiness or fatigue, lack of energy. Weight gain or weight loss. Joint pain. Dry mouth. Dizziness. Pharmacodynamic. Vilazodone increases serotonin levels in the brain by inhibiting the reuptake of serotonin while acting as a partial agonist on serotonin 1A receptors. Due to this activity, Vilazodone has sometimes been referred to as a selective partial agonist and reuptake inhibitor, SPARI. Mechanism of action. Vilazodone selectively inhibits serotonin reuptake in the central nervous system as well as acting as a partial agonist of 5-HT1A receptors. The exact mechanism for how these effects translate to its antidepressant effects are not known, though there is an association between these effects and antidepressant activity. Half-life. 25 hours. Other studies show a half-life of 24 plus or minus 5.2 h with a single 40 mg dose and 28.9 plus or minus 3.2 h with repeated doses. Dose. Major depressive disorder. 10 mg PO q-day for 7 days with food, then increase to 20 mg q-day with food. May increase further up to 40 mg per day after a minimum of 7 days between dosage increases. Target maintenance dose, 20 to 40 mg/day. Prior to initiating, screen patients for a personal or family history of bipolar disorder, mania, or hypomania. Safety advice. Vilazodone is a selective serotonin reuptake inhibitor and 5-HT1A receptor partial agonist and is designated by the U.S. Food and Drug Administration as Pregnancy Category C. That's all the information about Vilazodone we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.